I welcome you all to our Smarter Benefits launch. I feel smarter already. I want to introduce you to my friend Chuck Newman. Chuck's been an Academy sponsor for a long time now. He's helped the Academy have good health coverage. And when he first came on board a while ago, I don't know, 10 years ago or so, he saved us many thousands of dollars off whatever our premium was at the time, and continues to find inventive ways of saving us as much money as possible while still providing adequate health coverage to all of your Academy's favorite staffers. So we are especially indebted to Chuck for keeping us healthy. And Chuck often hooks us up with his friends and gets us special access to cool things like Smarter Benefits. So take it away, Chuck.
Thank you so much, Michelle. And it's been my pleasure to serve the Academy for that many years. I didn't realize it was a decade, but yeah, time flies. So everyone on the call, thank you for joining. We are employee benefits brokers. So we work with every health insurer out there. And as Michelle indicated, we try to find the best options. There's small group health insurance and large group health insurance, and then there's insurance for individuals. And with regard to that last category, what we find with a lot of solo practitioners, of counsels, 1099 staffers, really the better benefits, the better networks with respect to accessing doctors, hospitals, et cetera, are not generally available. So when Tim Varone, who I'll introduce in a second, came along with his firm BenAdvance with a product that I felt was worth introducing to the Academy, I spoke with Michelle about it. We vetted it. We looked at the benefits and decided that this would become a member benefit for the Academy. So I'm going to let Tim talk about the benefits. We'd invite your questions and your follow-up. Whatever it is that you have, if it's of a personal nature, we'd certainly invite you to reach out to us individually afterward to really discuss a personal medical situation that you don't want to discuss in the chat or something like that. So without further ado, Tim Varone from BenAdvance to talk about your Smarter Benefits program.
Great. Thanks, Chuck. Thanks, everyone. Thanks, Michelle and Chuck, for setting this up. I appreciate the opportunity. As everyone knows, benefits are expensive and they're challenging. And what we wanted to put together is a comprehensive platform for you to be able to offer large group, national access plans, dental, vision, life insurance, and a full suite of products. So I'm going to go through a PowerPoint now. I will show you, we'll walk through the benefits. We'll stop periodically for some question and answer. But let me share my screen and I will walk you through the presentation here. So give me 1 second here. So we're going to go back to the health options. We have national PPO options through Cigna or Blue Cross Network. Some of the ancillary options, some supplemental options in terms of how you can round out your portfolio now if you don't need our health insurance. And stop for questions and answer and show you how to enroll. Very easy process. So we'll start with the health insurance. Health insurance is a very important piece. And when we talk about associations and groups like yours, getting access to high quality benefits is challenging. Most people are stuck with a Obamacare plan, some type of limited type of product. And what we're talking about today are national PPO plans using some of the best networks in the country. So if you think about that, if you're traveling, you're out of New York, you're in New Jersey, you're traveling around the country, a health plan that goes with you and gives you access to coverage wherever you are is so important. And that's what we're going to talk about today. We're going to talk about dental, we're going to talk about vision, life insurance, disability, and deductible gap plans. These are cash reimbursement plans that work with any plan that you have today to be able to offset some of those costs associated with the plan. So hospitalizations, accidents, injuries, all those will give you cash reimbursements if you utilize those plans. So some of the differences in plans. On the marketplace or Obamacare, usually what you're going to see is limited doctor choice. So you'll see a sub-network, you'll see a smaller network, a local only network, usually with no access outside of the state, or a tiered network, which is confusing. If you have Oscar, what network are they in? Are they in a tier 1 or tier 2, things like that? It gets challenging. And importantly, no national access. So if you travel, your kids get hurt, you're on the road, give you the ability to get access where you need to get services covered. Usually they have higher deductibles. Most services would go through that deductible. So office visits, things like that would be deductible first. With our plans, we'll talk about how you get office visit co-payments before the deductible, and really high max amount of pockets. And that's what's going to protect you, is that what's your top end exposure when you use your health plan. We'll talk about how these plans work. What we're offering you is plans that have broad access to doctors, national PPO plans. And this is something that's not available in the traditional markets. So to get access to doctors around the country is really is a really big issue, especially locally too. So if you're in New York and you want to have access to doctors, many of the plans you have access to today through the exchanges or small group plans might have a limited network, might not have all the doctors in the network. We'll talk about that as well. And have access to out-of-network benefits. So if you have a provider that doesn't take your insurance, it doesn't take any insurance, to be able to get you a reimbursement for those out-of-network providers is something we can provide. And talk about some of the positive and negatives of having out-of-network benefits and things to be aware of. We're going to talk about plans that have co-payments first, RX before the deductible, and choice, giving you options from deductibles from $3,000 up to $5,000 and HSA options up to $6,750. The networks we'll talk about are Cigna and Blue Cross and how we deliver those. National PPO plans, as we talked about before, with much richer benefits, and for most people, a much lower cost than the plans you have today. These plans are not guarantee issue, meaning that there's not, they're not guaranteed acceptance. So there is a pre-medical screening for these plans so that you have access to the plans. It's a 10-question survey. You do that over the phone with my enrollment team to get access to the plans. And we see a very, very, very high level of people getting into the plan. So don't let that be a deterrent. See about the plans and see if you qualify for the plans, because they're really strong offerings with very strong coverage. We'll talk about the Cigna plans first. So the lowest cost plan you're going to see through our offering is that Advantage 5000 plan. With this plan, you have office visit co-payments. So all of your office visits are covered without the deductible. So that's your primary, your specialist, your urgent care. On this plan, your prescription coverage would be after the deductible. So we'll talk about that and how that works. The deductibles on these plans, they're all going to work the same way. So I'll walk you through the generals of how the deductible works. If you have to get a major service done, a hospitalization, emergency room visit, MRI, CAT scan, something like that, the individual would have a $5,000 deductible. Once they satisfy that deductible, we pay 70% of the remaining cost up to the max amount of pocket of $8,150. Once you've paid $8,150 out of your pocket through the calendar year, all services are covered at 100% after that. If you're insuring your family, one person hits that $5,000, the rest of your family adds up to the other half of that, the other $5,000. And then the same thing for the max amount of pocket. So one person hits $8,150, the rest of the family adds up to the other half of that. These plans have out-of-network benefits as well. You see the deductible, all out-of-network services will go through that deductible. You don't have that max amount of pocket. So you don't have that cap on your out-of-network plans. So that's something to be aware of when you go out of network, is that do it knowingly. You're going to get a reimbursement back. Your doctor will probably, look for maybe additional monies in terms of balance billing. So if you're going out of network, do it knowingly, know what they're going to charge, get an idea of what those fees would be. You can contact my team and we can see what the reimbursement would be to make sure you know what you're getting into when you go out of network. And we're going to reimburse at 125% of what Medicare offers. Another things about the plan that just to be aware of is for hospitalizations. So inpatient hospitalizations, you're limited to 120 days per calendar year. So if you're in the hospital for over 120 days, we can work with the administrator to get that covered, but there isn't plan language in there that you have to be, it's capped at 120 days per calendar year. The Silver 3000 plan, it's a lower deductible, same max amount of pocket, slightly higher co-payments, same thing for primary, for specialists, and for urgent care. But on this plan, your prescription's covered without that deductible. Generic medications are covered for free, so there's no cost sharing. It's covered. There's no out-of-pocket cost. And the same thing for mail order. So if you do take a mail order medication, you do take generic medications, there's no cost to you. The second tier medications, you would be responsible for 25% of our discounted price. So what is that second tier medication? These are name brand medications that don't have a generic equivalent or less costly alternative. So those are usually the ones that are still on patent, or they're very specialty for what they're going to do. The third tier drugs, these are drugs that have a less costly alternative or a generic equivalent. You would pay 50% of the discounted price, and that would all go towards your max amount of pocket as well. If you're paying 50% for medication and you want to pay less, you can talk to your doctor and pharmacist about other low-cost alternatives, generic medications, other name brand drugs that do the same thing that might be lower out-of-pocket cost. On that plan, the single rate would be $769. And you see as the rates go up, the family tier of under $2,000 is a very competitive price, especially for New York, where we see rates that are really, really high with lower quality plans. The Elite 1000 plan is our richest plan in the Cigna suite. This plan has a $1,000 deductible. It has the same $8,150 max amount of pocket, a slightly higher coinsurance, but lower co-payments. If you're thinking about which plan's best for you, the Elite 1000 plan also gives you office visit co-payments for outpatient mental health therapy visits. So that's something to think about when you're thinking about your decision. One thing we'll talk about towards the end of the presentation is plans that we can use to offset those deductible charges. So you see there's a very big price difference between the Silver 3000 and the Elite 1000. I'll show you some strategies, down the line in the presentation that you can get a similar or better benefit for a lower cost if the outpatient mental health visit is not the deal breaker for you. I'm going to go through the Blue Cross plans and I'll stop for questions after that. So the Blue Cross plans are our top selling suite of plans. They use the Blue Card National PPO network, which is one of the largest networks you'll see around the country, and access to all the Blue Cross and Blue Shield doctors within your area. Even if you take a local plan, a lot of times there's maybe a smaller sub network that you're going to be using. So these Blue Cross plans are a really strong option. The first plan is the Blue Card HSA. This plan is tied to a health savings account. On this plan, all services except for your preventive care goes through the deductible. Your preventive care, your normal wellness visits are all covered at 100% on all plans with no cost to you, just like any other plan you would have. But on the HSA plan, all services would go through the deductible first. You have a slightly lower max amount of pocket on the other plans, and you can use a health savings account to cover these costs. The health savings account is a nice vehicle to be able to use for investments, to be able to offset some of your income, with some tax savings, and more importantly, be able to help you cover the out-of-pocket expenses with pre-tax savings. So we could talk about, if that's a strategy that you like, we can talk about that and how to be able to set up with a health savings account. Our top selling plan is the Blue Card 2500 plan. It has a $2,500 deductible, the $8,150 max amount of pocket. The deductibles and max out of pocket work the same way as the other plans. So one person hits the individual deductible. If you're in a family, the rest of your family unit adds up to the other half of that deductible and max out of pocket. With this plan, office visits are $40 and $60. Prescription works the exact same way. $0 for your generics. You pay 25% for your name brands that don't have a less costly alternative, and 50% for the name brand drugs that have a less costly alternative. So these plans, that's our top selling plan. It's a very, very palatable deductible with a high level of co-insurance, and more importantly, office visits without the deductible. And for me, I think that's a very important piece, is that to go to a doctor visit, if you're paying for insurance, that co-payment's important. Make sure that you have access to plans to lower your out-of-pocket costs at the point of sale versus having limited visits or things that have to go through the deductible. Also the same out-of-network benefits, slightly lower deductible, $8,150. No max amount of pocket on the out-of-network, and that co-insurance, we reimburse 50% of the charges up to 125% of Medicare. $763 for the single, and you'll see the family rate under $2,000. So once again, really strong national options for you without a lot of the deductible charges for office visits. And that Blue Card 350 is our most our richest plan, with a $350 deductible, $30 co-payments for office visits for primary, $50 for specialists, $30 for urgent care, and $30 for your mental health providers as well. This is going to be the strongest plan you're going to see in the open market in terms of what's out there for exchanges as well. To my knowledge, the richest plan on the exchanges is an Oscar plan with a $600 deductible, and office visits go through that as well. So if you're looking for the best of the best plans, this is the strongest plan you're going to see for individuals and small groups. Let me stop for questions real quick.
So I don't know, can you see the questions?
Yeah, I do. Yeah, Chuck, I have the question. I'll read through them. Sure. Yes, the written materials will be available to Michelle. So we're going to post the webinar on the site, and also be recorded for future plans. If you're currently on Medicare, that's something that you'd want to talk to Chuck about, is maybe some Medicare supplement plans or things like that that actually can be able to offset some Medicare charges. The costs are per month. So, and they are a composite rate, which means it doesn't adjust based on your age, your gender, or where you live, which is a really nice feature of these plans. The maximum age for a HSA contribution, Chuck, if you maybe can step in here, is that?
Yeah, I don't believe there's a maximum stipulation on that. You have to have a high deductible health savings account compatible plan. There is a catch-up contribution allowed after age 55 to a health savings account, but I have never seen a maximum age. I'll look that up for you.
Yeah, I didn't think there was one either, but that's a really good question. So we'll go to the next piece of the presentation here. So we'll talk about dental insurance. And once again, all of these plans can be purchased a la carte. So you don't need to buy the health plan. There's no minimums or things like that. You can buy whichever plan fits your needs. And with all of our plans, you can enroll any month you want. As long as you enroll by the 18th of the month, your coverage is effective the 1st of the next month. So it gives you a little bit of flexibility where there's usually not flexibility in this market. With these plans, we offer plans through MetLife and Solstice. MetLife is a national PPO plan and offers a much richer benefit that's usually available in the dental space. We give you an annual maximum of up to $3,000, which means that MetLife will pay $3,000 on your behalf towards your dental coverage using that, with all their providers. Also have options with orthodontia. So if you have a child that's under the age of 19, we cover orthodontia up to $2,000, and it covers all major services day one: implants, extractions. If you need to get any major dental work, root canals, things like that, are all available for you without a waiting period. So it'll be available the first day of coverage. And the costs range anywhere from $43 to $93, depending on the plan you choose. Solstice is another carrier that we utilize that has a really strong network, has a really strong plan at a very low price point. So they include cosmetic procedures and discounts of those, orthodontia, implants, and another large national PPO network. And they've actually increased their annual maximum up to $3,000 at a price of about $60 for an individual. So if you're looking for a really strong option that has a really high annual maximum at a low cost, the Solstice options are a really great fit with a really strong network of doctors in the New York area. And also on the Solstice plan includes $7,000 of term life included in every plan. So it's a small amount of term life that's available through that plan as well. And those plans start at $37 with a fee schedule plan. Those are plans that don't have any type of maximums to it. You pay the discounted price of the carrier and have unlimited utilization. I'll go through the vision coverage and I'll stop for questions. Vision coverage is another nice option to have. Once again, not usually available for for the individuals in the small groups, but this plan is a very strong plan as well. And what's nice about this is you can pick it up any month. So if you need, if you need glasses, if you need your preventive exam, the Academy is giving you a great service by getting access to these benefits when you need it for all of these plans. We have preventive exams as low as $0 for the high plan. The low plan has a $20 copayment for the preventive eye exam. In both plans, exams and lenses are available every 12 months. Frames on the high plan are available every 12 months. On the low plan, it's every 2 years. And laser vision discounts as well. So these plans range from $11 to $21 based on the high plan. If you're thinking about which one fits best for you, if you wear glasses, if you use corrective lenses, the big difference to me would be if you want to be able to get frames every year. If it's a $20 copayment once a year for your preventive eye exam, I'd rather save $10 a month and take that lower plan. But once again, we give you the options to choose which one fits best for you. And Solstice has the exact same options as well. So preventive exam is $10, it's a little bit less. And their high plan also has a 12-month contract for their hardware and frames. So let's stop real quick and go to some questions.
I'll answer that HSA question. I went on the IRS website. There's publication 969 on the IRS website. It does not mention a maximum age, but it does say once you are enrolled in Medicare, you can no longer contribute to an HSA. So that would seem to answer that question. If you age out and are in Medicare, then you're no longer contributing to an HSA.
Thanks, Chuck. That's a way to find the answer quickly. That's it. That was a tough one. So a couple of questions we have out there is, what is the average increase on the premiums? The great thing about these plans is the renewals are really low. If you're on the public market, you see double-digit renewals regularly. The health plans have renewed over the last couple of years between 3% and 7% for the last 7 years. The ancillary and dental coverages have seen 0% increase for the last 3 years. So they run really well, and the rates are very stable. The next question is, do the plans cover pre-existing conditions? So there is a pre-medical screening. So as long as you pass that pre-medical screening, all of your pre-existing conditions will be covered without any limitations. But there is that pre-medical screening before you have access to the health plans. But once you're on the plan, all services are covered. These are ACA compliant plans, so you'll get a 1095 as a credible coverage. And it'll cover all the major services the same way you would on a exchange level plan. Preventive services are covered for free, but pre-existing conditions would not be concerned once you're accepted onto the plan. The sign-up date, the nice thing about this is that you have flexibility when you can sign up. As long as you sign up by the 18th of the month, your coverage is effective the 1st of the next month. So you do get the ability to get benefits as you need it. So this will be a long-term partnership with us. But the value of these plans is very important. The other thing to note too, is I've had confusion with other groups, is if you like one of these plans and it's a great fit for what you want to do and you're on an open market exchange plan, you can drop that plan at any time. Once you get approval into our plan, you give the carrier notice, you can drop that plan and take our plan for any effective date that you might want to say. The next question is, if they can purchase a Solstice plan to cover implants? You can absolutely do that. You can have multiple dental plans. Sometimes it might be cost prohibitive to do that. You might want to look at some other, maybe taking it as a total takeover, but you can take our plan to cover the holes in your other plan. Let's scroll down to some other questions here. Is the dental insurance plans? There's a link in the site which we'll circulate as well, and we'll post that on the Academy website, where you can look up your dentist and look up doctors on all the networks. And yes, all of these plans, everything we're talking about is available for anyone, no matter where you live. So if you do live outside of New York, all of these plans do have access to this. If I have a union deadline, yep, you can supplement our plan with anything you want. So if you pick up a plan, you can use it to supplement any other coverages you have. And are there many participating providers? The networks that we're utilizing are some of the strongest in the country. So these are very, very large national networks. They are much stronger than networks you're going to see in the open market. So these are really strong networks. I would encourage you to look up your doctors, dentists. If you call them, ask them if they take the Blue Cross Blue Shield PPO plan, the Cigna PPO plan for the medical, MetLife PPO for the dental, and Solstice PPO for the dental as well. Yeah, all these plans are available individually. So if you wanted to buy just the dental or vision, you absolutely can. And if you want to use it to supplement Medicare, there's no age limitations on my plans. The dental plan especially is a really good fit for that. There's no age limitations, and it covers dentures and major services that some Medicare plans maybe have a long waiting period for. There's no bundle. They're both priced individually, but you can buy both. And there's no pre-existing conditions or waiting periods for dental or vision. So these are all covered. The vision plan is for your preventive eye exams. So preventive screenings, hardware, things like that. And if you have type 2 diabetes, you're still eligible for the plan. We're looking for if you're on insulin, that could be a concern. But if you're
talking about health insurance there, or dental or vision too?
It looks like the screening for, I think it's probably more of a medical question. And Sam, if I missed that, please, can correct me. But if it's for the medical questions, we can talk about your individual questions offline if you wanted to. But as long as it's not a major concern, as long as they're not insulin, then there'd be no concerns with you getting the coverages. If you're no longer a member of the Academy, this is for Academy members. So we're looking for Academy members. We're going to talk about the enrollment process and the validation for you being an Academy member. But we're a partner of the Academy, so this is exclusively for your
Why would anyone not be a member of the Academy? That question is bonkers. Obviously, you're going to still be a member of the Academy. I mean, that's just obvious. It's just obvious. Okay, good.
No problem, Michelle. I figured that one. Yeah, I knew you were going to chime in on that one. But yeah, with everything we're talking about, these all can be purchased a la carte. They can be purchased without an age limitation and give you access to plans if it to offset other things you might have limitations with. So let's keep on moving along here. Deductible gap plans. These work with any plan we talked about or any current health plan that you might have. So what do? They give you cash reimbursements for services that, when you have to use major services. So an accident plan, for example, if you slip and fall, you hurt yourself and you have to go to the hospital for a service, they'll reimburse you for, based on the cause of the issue. So for example, I have a 4-year-old daughter. She likes to swing. She's a little girl, so she won't let me help her with anything. And she fell off the swing, fell on her back. Everything was fine, but my wife wanted to go to the emergency room to make sure there was no issues, no concussions, things like that. My out-of-pocket costs with my health plan were $1,200 for the emergency room, but I got $1,000 reimbursement back for this accident plan. These plans are very low cost. They work with any insurance. Plans under $40 for this, so and even lower depending on the levels of coverage. A hospital indemnity plan will reimburse you for out-of-pocket costs associated with a hospital visit for any reason. Anywhere from $1,000 to $2,500 per admission, and anywhere from $100 to $1,000 per day per confinement. So if you saw some of the pricing we talked about, some of the plans with the lower deductible, with a couple $100 difference between the plans, these hospital indemnity plans can cover those out-of-pocket costs for a fraction of the price, $30 to $90 depending on the plan. And critical illness plans, these will pay you a lump sum amount based on a diagnosis of a critical condition, anywhere from $10,000 to $50,000. And some conditions, they'll pay 3 times the face value of the plan to offset the cost for the treatment of these plans. It's not just going to the doctor. It's just not the surgeries. Your life's affected. Your work life's affected. So it helps offset some of those costs. These are good things to have for those what ifs at a very low cost. They're really strong options. They work with any health plan out there. So if you don't take our health plans, if you have a plan that you love, you have a group plan that you love, absolutely you can use these to offset any cost with any health plan. And on these topics too, if we have a groups on the call, we could package these and put these in as a group offering for you as well and bill the employer. So these can be purchased individually or as group plans. On top of that, we have some lifestyle benefits. So these are things that are just additional things that we have access to. Identity protection, medical billing solutions. So if you have a plan, maybe that you have a higher deductible, they'll help negotiate the cost for you and negotiate the price down for these facilities. Pet insurance, so discounts for pet care, vet experts, things like that, book sitters and walkers. So there's a lot of access to plans and access to information here. And we're going to have a portal for you guys that you can enroll on a lot of these products with directly. The health plan, you have to go through the screening process or calling my team, but giving you access to these plans is something you're going to have access to starting tomorrow when the program goes live. Let me see any questions on the chat that we didn't go over yet.
I think there was an additional couple.
How long does it take to be reimbursed? Their claims payment is less than 10 days. So once you get your EOB from the facility, you submit it to the carrier, and you'll be reimbursed within a week normally. And let's see.
Maybe that was the last.
That was the new one.
Yeah, I think you did get to all the questions.
Yeah, so we're going to talk about how this is going to be delivered, and then leave it open for questions at the end. So we partner with a company called Meridio. Meridio does outreach, and they run their call center and some of the marketing pieces that we're going to do. So they're our partner with the Academy on this process. What the goal is to give you a guided experience. So they want to make sure they answer your questions, they answer your personal questions, they help you enroll in products, and make the experience something where you have an expert on the phone with. So what's going to happen is that you're going to see correspondence going out. That'll drive you to a landing page. That'll drive you the way to schedule an appointment with one of our enrollers. They're all U.S. domiciled. They're all licensed life and health members as well. So they're all licensed people and have really strong expertise in these products. So they'll help you guide that experience. We're offering benefits that are very strong benefits with national carriers that have very, very high rates. And nothing's lower than an A-rated carrier for us. We can do, and all the products are guarantee issue except for the health. The health is the one with the pre-screening. So If you're thinking about dental, vision, life insurance, so life insurance, we do $150,000 of guarantee issue, meaning no medical screening, no questions asked, fill out the application, and you have $150,000 of life insurance. We're all guarantee issue. Billing is simple. We do ACH for the health plans, but all the other coverages, you can do credit card or ACH and split it how you want to see fit. So the billing is something that we're very flexible with. And if we have groups on the call, we can absolutely replace your current coverage, put it into your section 125 or your cafeteria plan to give you access to the plans you have, our plans today through your current delivery. And customer support, we're here for every step of the way. Most people are making 2 or 3 calls to our enrollment team before they make a decision. Use my team to make sure you can make a good educated decision and address your individual needs. This is a sample of what the landing page is going to look like. So you're going to go, all the materials you're going to see, marketing pieces, things like that will drive you to this landing page. You're going to see a chat that comes up, a bot chat. The purpose of that is to put you with the right enroller. So if you want to talk about health insurance, it's a little bit longer conversation than dental and vision. And we have highly trained people that focus on the health insurance plans. So you're going to use that. You're going to get a link back once you complete that to that landing page I talked about. It'll also be available through the Academy site. But once again, we're going to make sure that you have the experience you need to make sure you can make a good informed decision. Let me see. I got a couple of questions on the chat. Great. Yeah, so how do we contact to discuss? Michelle has my direct contact information, but Donna, you're going to get correspondence that's going to be going out starting early next week to drive you to that landing page to schedule an appointment. But yeah, we're going to be able to save you a whole lot of money versus that Oscar plan that you have. Yeah, so Pete, I think you left you said you called, left a message. Your group will be live as of Monday. But Michelle, if Pete, you want to give Pete my information, I can absolutely put him in contact with my enrollers if we want to get moving beforehand. And how much is $150,000 of life insurance without the health screenings? Samantha, this doesn't depend on your age. So that will depend on your age. I'm 42, and for me, it was $37 a month. The pet insurance plan that we're talking about is a discount product. So it's not a true, pet insurance product, but gives you discounts to providers, access to online support, telemedicine for pet care. A traditional pet insurance plan can be very expensive. These plans are anywhere between $9 and $20 a month and give you access to really good discounts and access to strong providers.
Webinaring, can I call you back?
Are you retarded?
What?
Hey, Michelle, you're not muted.
Michelle, we can hear you.
They asked me to be part of the fucking team.
Pete,
Do we offer disability coverage? Yes, there is disability coverage available as well. You'll see access to that on the site we're going to be putting out for you guys, as well as the call center. So absolutely use the call center for that disability coverage. And once again, that call center will be live on Monday. Anyone before that, you feel free to have my contact information. I'll put you in line with that.
yeah, I put, I don't know if everyone can see it. I put Tim's information in the chat, my information in the chat. For those Medicare questions, I'm happy to assist in connecting you with a Medicare supplement resource. These plans are not Medicare supplements. Those are very specific to Medicare. So we have good folks who focus and concentrate on that, of course, and we can assist you with group health insurance as well.
Absolutely. And Chuck does a great job with those Medicare questions. Let's see. Do we have any other questions before we and what's going to happen next is that you're going to get a survey from Michelle about what plans were really most important.
I'm going to launch it right now. Let's
There
do
we
the
go.
on-screen poll. So
So
are you
this way-
interested in learning more about, here comes a poll. You should see it magically appear on your screen. Just click one of those health, dental, vision, life, and let us know what you want to hear more about. And we'll do, a more in-depth version of this maybe for each.
Absolutely. I mean, this is the launch. So this is the beginning of this program. So it's an ongoing program. So if there's things you want to hear more about, you want to hear about dental, vision, life, you like those hospital, those deductible gap plans, pet insurance, we can have targeted webinars for 15 minutes or so to really go through those plans in detail to make sure that you understand all the options available and you can enroll in the products that make sense for you and your families.
There's a question in the chat. about pre-existing condition, would that incur a higher family premium, Tim?
No, it would not. So as long as your family passes the medical questionnaire, the premiums are the same. So it's a pass fail underwrite. So it doesn't matter, you know, as long as you get approved into the plan, the rates will stay the same. And it doesn't matter your age. So those rates we showed, doesn't matter if you're 25 or you're 55, the rates will be the same.
Did we get all the questions?
It looks like we did. And Michelle will probably send out.
Someone wants to email about pet insurance. Yes, Tim's information is
Absolutely.
Someone did not see the poll.
And don't stress it.
Okay.
And I put up the here, I'm going to give everybody a link to Tim's PowerPoint right now. Boop. It's in the chat, just trialacademy.org/SmarterBenefits PPT. So that's Tim's PowerPoint. So if you just want to review everything that Tim just went over, it's right there. You can just go straight to that link and it should pop right up. You can also always email us, info@trialacademy.org, and we will be happy to send your emails to Tim or to Chuck or wherever it is they belong. I'm going to share these results because I think they're interesting. So here, let's do end poll, share results. Most of you want, I guess this isn't that surprising, want to hear about health insurance. That's followed by dental, then vision, life, and then other, which was just because I couldn't remember what else Tim told me to write. And
pet insurance, who knows?
Health, life, I don't know, car, pet, dog, whatever. What else can you get insurance for? Everything, right?
You can get insurance for everything.
Much
And
everything.
Michelle, I'm going to send you the link too for the marketplace too. So if people wanted to buy something directly, they didn't need, I don't want to talk to an enroller. You can do that through the portal as well. We can put it on the Academy site. And then the only thing that would need that pre-screening call would be the health insurance. But you'll see the correspondence going out shortly to, you know, the marketing going out shortly within the next couple of days to drive that landing page, to make an appointment with one of my enrollment team. And they'll reach out to you based on your scheduled time that you put in there. So I look forward to working with everyone. I appreciate the opportunity, Chuck and Michelle, to present to your, to the team here. And anything you need, please let me know. We're here to help you guys out and make this a really good experience for you.
Awesome.
Thank you,
And I
Michelle.
just
Thanks, Tim.
put both those links in for the attendees too. One is to that sort of main page for the Academy portal so that you can buy stuff or schedule a call to talk to somebody. And the other is for Tim's materials.
Perfect. And you'll see that the phone number for the call center will be in the marketing pieces. So just be aware of that.
Yeah, totally. I
Good
can put
stuff.
it in the chat too. I have it right. It's right on the top of this webpage I'm already on. Boop. Ta-da! I love
Look
it.
at that. Yeah, that'll be a live number. I'll have them turn it on for you guys tomorrow.
Okay, perfect. Awesome.
Great. Thanks so much.
Everybody.
Thank you, everyone.
Thanks for joining us.
Appreciate it.
Stay well.
Bye.
Bye.
Bye-bye.